enter the room.
Good evening. Good evening. My name is Dr. Oluwaka Komolafe. I'm one of the doctors in this GP surgery. Am I on to Mrs. Could you please confirm your name, please?
Hi, yes, this is LM Taylor.
Oh, thank you. Is this an appropriate time to call you?
Yeah, it is. I've been expecting your call. Doctor, is this a joke? I got an invitation for pap smear.
Okay. Before we go on, could you please confirm your age and the first line of your address, please?
Yeah, I'm 25 years and it's 123 Maple Street.
Oh, thank you. Is this number reliable? So that is it number that ends with 223, so that in case there's a disconnection, I can call you back?
Yeah, you can call me back on the same number.
Oh, thank you. Do you have about 10 minutes to spare for this consultation?
I'm sorry?
I want you to spare me a few minutes for this consultation. Is that okay with you?
Yes, of course.
Okay, thank you. What is the exact reason why you want to discuss with us?
Yeah, I got an invitation for a pap smear. And why would I need a pap smear?
Oh, thank you. Well, I understand your feelings, but do you know what pap smear is?
Yeah, I know it's used for screening for like STIs, but I'm a lesbian. All right, why would I need a pap smear?
Okay, I understand the way you feel. But before we go ahead, let me ask you some few questions. Have you ever, at any point in time, I want to ask you some personal questions. Is it okay with you?
Yeah.
Okay, thank you. When is your last menstrual period?
That was just 2 weeks ago.
Okay, thank you. I want to ask you about your sex life. Is it comfortable with you?
Yeah, sure.
Okay, you said you're a lesbian. Before you, have you had any sexual partner that is a male before?
No.
Okay, thank you. Now, do you experience any discharge at one point or the other from your front passage?
No, not really.
Okay, what kind of type of sex do you practice?
We use sex toys.
Okay, I understand you. Now, it is true that this medical this test is used to test for certain things, but not for sexually transmitted disease. Do you understand me?
Okay.
What we actually test for is to see if, one, there are two things that we do with this test. The first thing is we test if the person is positive to human papilloma virus, which is a virus that can cause changes in the mouth of the womb called cervix. So these changes, if it is not appropriate, can sometimes lead to cancer. So the earlier we find out, the better. Do you understand me now?
Yeah, I understand.
Okay. So for every woman in England that has a womb, irrespective of their sexual orientation or sexual partner, we invite them to undergo this screening. Do you understand me? The reason is because apart from male to female sexual intercourse, there are other ways in which the virus can enter the body. For instance, through skin, through usage of sex toy, or even hands. So through this process, the human papilloma virus can enter the mouth of the womb, which we call cervix, and cause changes in the cells of this area. Do you understand?
Understand.
So it
Understand.
is
Okay, that makes
it is
sense.
okay. It is a simple test in which something very small will be used to apply to the cells of the mouth of the womb, and it will scoop just a little, and we will test it. So if we test that the person is positive for human papilloma virus, then we will now test for, we will send the cell taken from the mouth of the womb, send it to laboratory to find out if there are changes. So if the person
Okay.
tests negative, the person will
I'm
be
sorry, what
rescheduled.
changes?
If, when we test the person for human papilloma virus, if the person tests negative, there will be no need for what we call that laboratory phase of the test.
2 minutes remaining.
So
Okay, what
this test,
happens if it's not normal?
if it is not normal, then we'll send the person to do what we call colposcopy. So colposcopy is the test that something we will use to visualize that area to see whether there are precancerous or cancerous changes. So,
Okay.
okay, I'm going to give you some, I will recommend you to some websites, and NHS, including NHS website, where you can read more about this cervical screening. Are you with me?
Okay.
Okay.
Yeah.
So every woman will be invited to do this screening 3 years on between the ages of 25 and 49. And when they get to 50 to 65, the screening will be done every 5 years, unless there are
Okay.
certain special conditions that warrant it to be earlier than that. Do
Okay.
you?
Sure.
Okay. So will you? So
Will it be uncomfortable, the procedure?
is very straightforward and less comfortable. We will make sure that we use plastic instruments that will not injure you, and we are going to give you simple analgesic in case you have any pain. Do you have any more questions?
Okay, sure. But does my partner also have to get tested?
Yes, your question is very valid. Your partner, if the person has a womb, should also be tested. I'm able to answer your question.
Okay. Yeah. Understood.
Okay. Okay.
Move on to the next station.
Thank you.
Very good. Nice. You covered everything really well. I just have a small feedback. So you're still talking a lot. I think you know this case also really well. So you're talking way too much. So every time you say two sentences, just give a pause and
Okay.
ask the patient, do you have any specific questions? Because they'll have a list of questions in front of them that they want to ask you, and you're not giving them the chance at all. Like I know you have a lot of things that you need to say, but for example, for instance, what would I do about, I mean, like, why would I need to know what is going to happen above 45 years old people? Like, why, that's not relevant to me at all. I'm 25 years old. You just tell me how often I need to get it done. That's enough. You don't have to give the entire guidelines to the patient, right? That is something you need to know. Based on patient, you need to give them that relevant information. Okay. So so the rule of thumb is, try to keep just like, try to speak only two sentences at once. After every two sentences, give a pause, see if the patient wants to say something. If they don't, then ask them, do you have any specific questions? Or just ask them, are you following? If it's in the middle of a particular topic that you're talking about, just ask them, are you following me? But the better question is, do you have any specific questions that you want to ask? That is something that you need to keep asking them, because they have a lot of questions that they need to cover also. All right. But yeah, other than that, you did it really well. You covered all the data gathering points. Let's see the checklist. So yeah, data gathering, the points that you missed. So what do you know about pap smear? You asked that. So HPV. So if it's positive and if it's negative, what needs to be done? That also you mentioned. Yeah. So here the safety netting that you could have done is that you mentioned, you asked the questions like, do you have any discharge and things like that. But you can just give a small safety netting advice, like if you notice any bleeding in between your periods, or if you notice excessive bleeding during your periods, or if you notice bleeding after after sex, make sure that you come to a hospital, because those are the symptoms of cervical cancer, right? You just give a safety netting for that. That's something you can do. And leaflets and pamphlets, I think this you mentioned. Arrange a follow-up appointment. That's something that you can mention, like when is the thing is going to be. And after the pap smear, you can talk to them again and see how it went and if they had any issues. That's something you can mention about. So that's a follow-up here, basically. But other than that, IPS is pretty good. Yeah, not bad. This is an easy pass.
Please like and subscribe to TuringMedSchool. Good luck with your preparation.